Christophe, could you guess what's the top most workable city? So they actually asked people, 18,000 people, what would be the most workable city for them. So it's based on those people.
Just top of mind, I would say the first one would be Abu Dhabi. The second one would be Boston. Third one would be Brighton. Fourth one would be New York.
Someone's cheating.
Welcome to the Healthusiasm podcast, a panel discussion on innovations in health and self-care. My name is Christophe Jauquet. I'm a health business expert, author, and professional keynote speaker. Every week, I discuss with a panel of experts the positive changes that are shaping our health and happiness. And for this discussion, we have two of your beloved panels. Oh, that was not a good start. Two of your beloved experts in the panel. I could have used the word panelist. Two of your beloved panelists. Bad start of this episode, but let's get cracking with it. Calling in from Barcelona is our digital health connector, Aline Noizet.
Hola.
She's more awake than me. From Scotland, but living near Brighton, medical expert in digital innovation, Dr. Keith Grimes.
Fit like Abdi.
This means that we're missing out on, from Colombia, but living in Berlin, digital health expert for startups, Nia Escobar-Kulle, and also from Ghent, Belgium, human experience expert, Mo Zouina. How are you doing today, guys?
Very good.
Yeah, pretty good.
Good. We're coming at the end of the month of March, which means that at the end of every month, we look at what we've seen from health innovations in the past month, what healthusiasms that we see. And this will be the topic of today. You brought a couple of healthusiasms.
It's rather end of April, Christophe.
Did I say May?
March.
You said March.
March. Oh my God.
I think at this point we have to say we need to call in a sort of coffee strike on Christophe. Press the button and get a drone to deliver him a double espresso.
Okay, and I was about to say that I will start off with bringing you the first healthusiasm, but with the way that I've been starting things off here, let's hope all things go well. I want to talk about tech making healthcare human again. If I would be Donald Trump, I'll probably put it on a hat, but it would not look that good. TMHHA.
Tma.
Tma. It's not a MAGA or MAHA, but I think it's very important. And one of the particular things I want to talk about is curabots. So what is the problem? As we know, hospitals and care homes, they're under a lot of pressure. Nurses are overwhelmed. There's too much admin, too many patients, not enough time or staff. And so we all know burnout is real. It's growing. We talked about it on the show as well. And that's where these curabots come in. They're care robots who are built to do routine tasks that eat up time and energy. Think of delivering meds, delivering lab samples, transporting beds even, guiding visitors, disinfecting rooms, restocking supplies. So basic stuff that could be done easily today. I read an article about one of the big players in that, which is called Chang Robotics. And they are making smart robots that move through hospitals on their own, helping nurses by handling the repetitive work I just mentioned. These robots are very often co-designed with nurses to make sure that the robots fit really the actual work and the workflows that are out there. And I've read somewhere that in Texas, they completely automate the bed and equipment transport, for example. So it's no longer, people that are driving the patients around in their beds. It's the robots. And the feedback from the nurses was that it's like having a tireless teammate, and it allows them to have more time to talk to patients. It was a pilot, and when the pilot stopped, apparently nurses really came back to Chang Robotics saying, when can we have our friend back? Because it was helpful. And these things just don't only happen in Texas during pilots. They're happening in Japan. They're happening all over the world. Definitely in elderly and care centers. That's where you see it happening. Again, medication reminders, even to monitor vital signs, provide companionships so people are isolated or living alone. We saw it also in COVID, by the way, in Italy, where you needed to stay away from people who had COVID maybe. There were robots entering the rooms and having conversations, doing some basic tests. Impact is huge, less physical and emotional strain for caregivers, more quality time between nurses and patients speaks for itself, and perhaps even safer, more efficient hospital operations. So Robots are not taking over. We're not yet in that phase, but they're teaming up, helping humans to do what they do best: care, connect, bring comfort, the human part of it. And this is what Healthusiasm is all about. But there's also a bigger picture here, because we're talking robots, and robots are driven by AI. And I think the bigger picture here, and this is something which more and more people are talking about as well, is that we see a shift of a combination of AI plus emotional intelligence. AI plus EQ. It's the formula that we often see. So it's not just about robots or smart tech. It's about making all of healthcare feel more human again. This is what the whole segment was about. So it's about, robots that can help you with, simple struggles like physical exhaustion, but also AI helping behind the scene to maybe even cut admin work, coaching doctors on communication, even suggest them. I saw a study on that as well, suggest them with empathic comments or feedback to patients. And so what we're getting here, and I started off by saying tech making healthcare human again, TMHHA. Well, the thing behind it is that robots are freeing up time so that caregivers can connect, and AI is really clearing the clutter so that doctors and nurses can focus again and have that human relationship again. So it's not just about technology. It's not just about the smartness of technology. It's really about building empathetic systems that remember who you are, that connects with you as a care team, that makes you feel seen as a patient and not being a number, to really make healthcare, more human again.
It makes a lot of sense. I like it a lot.
Yeah, me too.
Good to hear.
I mean, of course, I always love technology, but no, it's great. And, the things that I like about hearing this story is it's focusing on an often neglected but critical part of the healthcare system, which is that of the nurses who provide so much care, and a lot of innovation tends to skew towards different groups, the doctors, the sort of other end of things. So that we're assisting the nurses who do so much of this is really helpful. What is interesting within all of this is, if I look at what's happening with ambient scribes in care as well, AI being used to transcribe conversations and create notes, two things happen. Number one, clinicians generally love it, and patients like it too. They feel much better, they feel less burnt out, they can attend to the patient more. But what you're seeing in the evaluations is they're coming out and saying, yes, but these things cost something, and they save some time, but they're not saving enough time, as in the ROI on the investment in terms of time saving and the doctors and nurses seeing more patients isn't enough. So there's a bit of pushback. And I find that really worrying, because here we have, in ambient scribes case, giving us a tool to make us more human, and then as humans, us forcing us to work more like machines as a result. And so when you talk about the robots in there, this is great. And if it does free up time for the nurses to care for patients more personally, my worry is that whoever's paying for this within a hospital might say, yeah, but they should be seeing more patients. They should be we've got lots of things to do. So we always have to watch out for that, I think, as well, is that when the space gets opened up, it gets protected.
Yeah, I think there's two ways to go about things, and it's always been that way with digital or technology, is that the first reflection is, how can we save money, right? Or how can we do more? I think that it's a logical reflection, but the big change, and the ones that survive and really make a difference in any industry whatsoever, is when you start thinking, how can we do things differently? This is where the change comes, when it's not just about doing faster or more, but really when you think about how can we do things differently. And that's a way more difficult exercise. But the question is, I had a discussion. I was teaching health innovation at a university to healthcare stakeholders. And they gave me because we were talking about this as well, and they gave me the example of saying, like, yeah, we now have a robot that cleans the rooms. So this allowed us to let go of the cleaning lady. And so that is one way of reflecting. But the question is, what can you do with that person in another way? Because maybe she's not trained as a nurse, but maybe she can talk to people, or she can do other stuff in that hospital that really brings value and that changes the experience, right? Yeah. And we're even talking, just with all respect, about a cleaning lady. We're not saying that we're replacing a nurse, we're replacing a cleaning lady. But even with somebody who's not educated medically, you can do a lot of things to improve the experience for patients.
But it's also, for me, for the hospitals, it's protecting their assets and the nurses, as Kate, you were saying. Because when in Japan, you have those robots who are lifting the patients, the nurse is not doing it. So it's actually protecting their body, their well-being. So for me, you have like employees that are more productive, in better health, because those robots are helping them.
Yeah. It comes down to sort of turning the ROI, speaking the language of the person paying the bill, the economic buyer in this one. And so, if any of these technologies reduces injuries, like you say, Aline, or reduces burnout, the way you sort of talk about this is like, well, what's the cost of burnout? It's staff turnover, it's time off sick, and that has a cash equivalent to it. And, so you can couch it that way, but there's still, within that, there's some time freed up. Can we just slot some more folk in? There was a study out in the BMJ recently which talked about the mortality impact of burnout. High levels of burnout in doctors and nurses in the hospital that were studied led to increased staff turnover, and increased staff turnover led to higher mortality rates in the patients. Like, the more staff turnover, more people die. And I don't think you can get a more comprehensive response to why it's important not to turn people over on this one. Is the bottom line literally patients dying, yet we still have to talk a little way about this. And I also like the idea of technology making us more human, and return to that later on this year. I'm doing a workshop at a festival called The Fix in the UK in September. The workshop I'm doing there is called Jailbreak: How AI Can Set Healthcare Free. And I'm talking specifically about examples where technology, AI in the case that I'm talking about, counterintuitively makes us more human, and how we can use that too. So, at the festival, we'll be talking about that, but it's something that we all have to engage with and protect, I think, as we get things freed up. How can we be more human in that moment?
And we're not there yet. I mean, I saw a recent study where they compared physicians with AI plus physicians, or physicians plus AI, to see where the medical accuracy, at this point, I'm talking medical accuracy first here, was best. And so obviously humans perform worst, but they always say, like, you need to work together with AI and then you outperform AI. At this point in time, we're not there yet. So with physicians that use AI perform worse than AI by itself, simply because most physicians don't trust AI yet. So we're not yet in that jailbreak moment, as you said, Keith, because I always compare it to the GPS. I think this is the best example that you could use there. I mean, there was a time when GPS came out. When the GPS would say turn right, you would say, nah, I'll go left, because I know it's shorter. These days, that's no longer the case. We don't even know where we are driving, because we almost literally blindly follow the GPS. And so we are in the stage still where physicians say, no, I go left because I don't trust to go right. I know better. While probably the GPS was already right to turn right. So we're not yet in that phase where we can jailbreak, and it's something that we need to learn to use in our everyday work, I think. Yeah.
But maybe the healthcare professionals don't know yet how to use AI properly. Like if we talk about ChatGPT, for me, you make the most of it if you use the best prompts, and that's part of a learning process.
Yeah. You just have to use it. Yeah.
I'm actually working together with a client of mine on it'd probably be global training on how AI will change the medical practice and what the physicians need to do to actually uptake it quicker. So it's a very interesting case. I've had a discussion this week to set this up with that party. I think it will be really, really, really nice, and much needed as well. Okay, so that was my TMHHA Healthusiasm. Up to you, Keith. What Healthusiasm did you see in the past month?
Well, my Healthusiasm is simple. It's walking. Now, I love my technology, don't get me wrong, but walking has been very important. That's important for a lot of reasons, but, particularly in the pandemic when we were limited, I spent a lot more time walking, and actually I've adopted early morning walks is a big part of my personal wellness these days. I'm very fortunate to live where I live in Seaford on the south coast. And so
how
I've
do you
got
do
access
then?
to,
You often told me that, but how? So you wake up and you immediately start walking, or?
yeah, well, what I do is so I wake up at 6 o'clock every day. I'm just an early person. And instead of just doom scrolling, what I do is I get up, brush my teeth, have a coffee, and then leave my headphones behind and just go out and walk. I walk for about half an hour, 45 minutes, or even an hour. And I walk up to the beach, or I walk up over the cliff down into the forest, or wherever it is. And I do that because I have ADHD, my mind's always kind of ticking over. And if I go out and walk, all the sort of ideas and things that I have kind of clear out. And then I get to a point where everything's kind of cleared through and I'm feeling, nice and clear, and I've been out in the countryside. And then when I come back, what I find is that I start the day in a nice way. I get to see nature and everything like that. I often solve problems that I've been thinking about without thinking about them too. I come back and all of a sudden I'm like, oh, I now know how to do that. So this is what I do. But in terms of the Healthusiasm, so big fan of this, but always thought that this is only really a benefit of being in the countryside. Nature, and there's a sort of great belief that nature is an important bit. But there was this paper called Walk to Wellbeing in Community Mental Health. Urban and green space walks provide transferable biopsychosocial benefits. Now, the first bit is it was a study done where they had a walking group for people with mental health issues facilitated by an occupational therapist. And the paper talks about the great benefits of walking as a community practice. Biologically, people feel better. Physically, they get fitter. They get fresh air and everything like that. Psychologically, they have a community. They feel less anxious or whatever's troubling them, but they also feel more activated and start doing things. And then socially, they have this date in the diary, a community that they build with, and even ecologically, they connect to the community. So that's all fine. I accept that. And actually, it's really good evidence of that. The thing that was interesting is that walking in an urban setting was equally as good. You didn't have to get out into nature. It was just the act of walking. And that felt like a very new thing to me. And then I reflected on it and I thought, well, actually, when I travel, I still wake up early. So Eileen, if you help me find an event somewhere else and I'll get up and I'll be in some fancy new city like Helsinki or wherever it is, and I'm up early, walking in a city or walking in a town is fascinating and just as healthy. I don't know about Beijing and its pollution or anything, or Delhi, but that aside, I get to see nature, but I get to see humanity as well. And so the article talks about that. And then there was a further article in The Guardian where Annabelle Streets, who's got a book called The Walking Cure, was talking about some of the specifics of the benefits of walking in an urban setting, particularly the sort of, you're in Barcelona, Eileen, like is it the Sagrada Familia? I'm not a religious person, but I have to say I felt very moved when I saw that. And yeah, anything that gets people that benefit, if it was just that point is like, you don't have to just go to the country. You don't have to be just fortunate for that. Walking anywhere puts you in touch with other humans and nature. And so, yeah, I wanted to share that with you and hear your thoughts because it's powerful for me and just opens things up a bit more.
I so agree with you because I think there's so many things like in Barcelona, for instance, we've got so many very nice architecture and just walking and paying attention to the buildings brings you so much, it's like, wow, I've never seen that building. I've never seen that detail here. Yeah.
That little shop or that person or that little patch of flowers growing out of the wall or that little piece of graffiti. Yeah.
Exactly. But Keith, do you know that Time Out published a list of the 20 most walkable cities this week?
Oh, yeah. Manish Juneja, shared friend, he shared it with me as well.
He sent it to me as well. Yeah.
Yeah.
Christophe, have you seen that list?
Yeah. I've lived in two of the top 10, Brighton and Eastbourne, Brighton and Edinburgh.
Okay. Well, Christophe, could you guess what's the top most walkable city? So they actually asked people, 18,000 people, what would be the most walkable city for them? So it's based on those people.
Just top of mind, I would say the first one would be Abu Dhabi. The second one would be Boston. Third one would be Brighton. Fourth one would be New York.
Someone's cheating.
Just top of mind, yeah.
I have to say, when I saw it and I saw Abu Dhabi, I've never been to Abu Dhabi. I've been to Dubai and Dubai was not walkable. And I was like, Manish, this is crazy. And he said, no. Abu Dhabi, downtown.
I've been to Abu Dhabi and I don't think it's a very walkable. Well, what is walkable is that the pavements are pretty, wide, but it's not
Maybe
like, I mean, it's too
flat
hot. It's impossible to walk. You don't see anybody walking outside anyway in Abu Dhabi. I was there in June, I think, and nobody was walking outside. So it's pretty remarkable I don't
was
see any
surprised
Belgian
not to
city.
see Barcelona, for instance, because I walk everywhere. I
Barcelona's
think
lovely.
it's a very enjoyable city to walk.
Yeah, Ghent as well.
Ghent is wonderful. That's part of the reason I visited Ghent. It's you're just walking around and seeing everything.
Yeah, exactly. Yeah, I'll stick to cities. I'll talk about health friendly cities, because you're talking about you need to walk in nature, you need to talk in cities. You can also do both, but more and more what we see is that cities have a nature friendly design, and that includes your local park. So we know that cities are full of life, but it can also be very noisy, very stressful. There's a lot of concrete everywhere, and so that's why we build parks in cities. But when we build parks in cities, to have that nature feeling, what we often do is that we push out the birds, we push out the insects, other wildlife, if you will, because the parks are not built for them. And so there's a study that came out recently that was done in Florida that showed that parks can support both people, humans, and animals if we plan it right. So if you want to have a walk in a park where you also have the biodiversity that normally should be in a park, they have a clear view on how to do that. And those are very obvious things. If you read them, there's you have to have the native plants that support bees and butterflies. You have to have or grow tree canopies to keep cities cool, quiet green zones, less moving and fewer lights to protect nature. Just pretty the simple things everywhere. And I was happy to see that, because I never thought about, if you have a park, do we actually have the wildlife and the nature in it, or is it just for humans? And I like the ideas of having both. Now, I came across another article related to that very recently, which was about Belgium, Antwerp. I don't know if you've been to Antwerp, the Diamond City. And Antwerp has decided to redesign the entire public spaces to fight the noise. And so their idea is to have quiet zones every 400 meters. At first, I was like, 400 meters that's already quite far. But maybe it's not, because having a quiet zone in the city is pretty challenging, right? And so the idea is to make sure that everyone can find a calm spot nearby. And so they're adding water fountains that create relaxing sounds, but that actually block traffic noise. Which is lovely. Around that neighborhood, they're slowing down cars. I know in Barcelona, Aline, you mentioned that as well, that there are a lot of the roads in Barcelona are no longer allowing traffic.
Like mine, yeah.
Like yours, indeed.
Yeah.
They're making sure that the road surfaces are different, so that less noise is made. They only allow electric vehicles, which also make less noise. And they've done all this by asking the citizens where and how they need peace the most. So they're really reshaping the entire city to make sure that you have that calmness there. Because indeed, if you think about cities, it's very often about, noise, stress, and so forth, which might raise your blood pressure, affect your sleep, harm your mental health, whatever you might have. So I really like both of these examples, and they fit with what you say. It's, if you want to walk in a city, you might want to have also the quiet place.
When you were talking about the parks, one of the things, I don't know if they mentioned this at all, but there's a friend of mine, Tristan Donovan. He does podcasts, but he's a journalist too, and he's written a few books, one of which was called Feral Cities. And in that, he investigated urban wildlife, things like, the baboons in Cape Town, feral chickens in Miami, all sorts of strange things. And in the UK where I live, there's lots of foxes. Foxes have really taken over there. And actually, I'm quite pleased to see them. I take measures in my own garden to try and make sure that it's nice for insects. But an important thing, I think, is how do animals get from Park A to Park B? That's the bit that I wasn't sure about. They need kind of green corridors as well, because otherwise you're going to get all the animals, not the ones that can't fly, have to get from A to B. And so I wonder whether they mentioned that at all, that there was a path that meant that you're not going to get, foxes squashed on roads and things. I just was driving here today. I saw a badger had been knocked over. And, I live in the countryside, so you see a bit of that. But I just think inside a city, if you want nature, nature has to be able to move around. I mean, it will, but there's maybe ways of allowing that.
Maybe they do that during the night.
Maybe. Yeah,
There's no people watching.
But also, I think if nature is there, I think animals can get used to the noise and the humans and parts as well. I was recently sitting on a terrace in the sun, and there was a duck walking around on the terrace. Ducks are typically a little bit afraid of humans, right? They just fly away or run away, whatever. But that duck was just walking in between the legs of humans, like really weird, far away from any water. Yeah.
Well,
but I think they're also adapting.
We see the same with the rats in Paris, right? Jardin des Tuileries. They're just co-living with the people there.
Okay. I quite like the natural world being part of this urban space. I know, we are animals as well. It's nice to share our space.
Cool. Aline, you had another Healthusiasm for us?
Yes. This month, I want to talk about holidays. So, the summer is coming soon. We're thinking about holidays. So my Healthusiasm this month is about time off in the workplace. So I read a few articles those past weeks related to this topic. So one was about Unhappy Leave put in place by a company in China, where employees can take up to 10 extra days off per year and not come to work if they don't feel like it. And then there was another article about unlimited holidays. So something that has grown in popularity across Europe in the past years to support employees' work-life balance. And just this month, a company in Holland, like KPN, a big telecom company, just put in place those unlimited holidays. And this actually led me to an article about Czech Republic, where a growing number of companies have been deploying this policy. One of the big insurance companies has been offering this unlimited leave policy for more than 7 years. And they had some interesting numbers to share that I found very interesting. So the statutory number of holidays in Czech Republic is 20 days. Then they can take some additional paid off time as long as it does not disrupt the team. So they really want to call on individuals' personal responsibility. And those holidays still need to be validated by the manager. In 2024, employees took an average of 7 extra days on top of the 20 days. 68% of the employees took advantage of the benefits, and the record was 24 additional days. So we see that the results are showing that it's taking time for employees to trust that they can actually take additional paid days, but it's a work in process. And the managers actually those generally taking less additional days because they feel a sense of responsibility for the team. But overall, it was showing that the policy seems to have a positive effect on employees, improving their satisfaction and the efficacy at work.
I worked at a company that had unlimited leave for a while. It didn't have it, and then they brought it in. And what was interesting is that they brought it in, and the amount of leave that people took went down. People took less leave as a result was the first thing. And maybe that is because of that trust thing or anything like that. But that is interesting. And then the mental health days, that was also adopted. I mean, that's been around for a while. They were unofficially called duvet days, or in Australia, when I was there were Doona days, the sort of mental health day. And then they kind of got captured in there that people could, they'd have to, people would schedule them as well. So there's a greater acceptance that for a person to stay well, the reasons that what they do to stay well could be manyfold. And part of that is just like, I just need a day to sit in front of the TV and watch the latest series of Black Mirror or whatever it is, or just get out for a walk. But no, it's nice to see that rising.
Actually, you're right. So I was working for a company here in Spain a few years ago, and we had some personal days. So we didn't have to justify them. And it was 9 days per year. So quite a good number, but that was super convenient. I could just, instead of using a holiday, I can use those days to do whatever I wanted, as you say, maybe stay at home or
family issues, medical appointments,
exactly.
The life, it's your life. Because otherwise life gets very much in the way of work.
Yeah,
it is one of the reasons why I like being independent so much, is that I don't need to explain to somebody why I maybe don't want to work or cannot work or should not work maybe today. Now, that being said, I think they always have good names. You were mentioning some of the names in Australia there. And in the Netherlands and Belgium, they are called baaldagen. So dagen is days, and baal comes from the word balen and means I'm fed up with something. So baaldagen, it sounds great, but it also means like I'm fed up with something. I need to be at home. It doesn't have to be work. It could be anything, right?
Yeah.
But it's similar to the unhappy days in China then, right?
Yeah, exactly. But I think it's only like one day or so a year that you're officially, like legally in the country your employer cannot ask you to have a proof by a physician that you were sick if it's only for one day.
In the UK,
otherwise you always need to go to a physician and showcase that you were sick, right?
In the UK, you can self-certify for 7 days, and then thereafter you need a medical certificate. So, but you can't just keep doing that, but it's interesting to hear how different countries deal with it.
I recently saw a wonderful quote, by the way, and it went something like this: we should move away from "I don't feel well today, I don't go to work," to something different. "I feel well today, I don't go to work."
Mm-hmm.
Because it's kind of stupid if you don't feel well that you then finally can spend some time at home. You actually should be able to spend time at home when you're feeling well. So I like that idea shift. Is like it's actually true. I mean, we should be able to spend more time at home if we do feel well.
Absolutely.
Okay, going to my last Healthusiasm real quick. We'll be talking about microplastics. Might have heard of it. There's tiny, itty tiny bits of plastics that are pretty much everywhere in your food, in your water, the air that we breathe, in your chewing gums. There's a piece of research that showcased how much plastic there is in chewing gums. And researchers have found out that if you look at fish 100 meters deep in the sea, they have microplastics in them. If we look at I think they researched 13 people deep in their lungs, and all 13 had microplastics in them. So it's really a huge problem. Now, these microplastics, they really can be found anywhere. So we're talking about lungs, but also your blood, your liver, brain, placenta, even in babies before they're born. So it's really a huge issue because it could increase your risk for heart attack, stroke, cancer, infertility. It could disrupt your hormones, damage your gut, lungs, brain. And it's now even linked to dementia. Apparently, people that have more microplastics in the brains have more risk of developing dementia. Now, there is a doctor in London, by the way, you probably read about it, Keith, maybe somewhere, that says that he could be using blood filtering treatments to remove the microplastics from your blood. The clinic is called Clarify Clinics in London, and the procedure is called Clary. Or Clary, I don't know how you pronounce it. And so they remove microplastics, forever chemicals, and other toxins from the bloodstream. It's 12,000 pounds, so it's not for everyone. And it's a treatment that is known as apheresis. You might know it.
Apheresis, yeah.
Okay, sounds better that way. And what it does is that it pulls blood out of your body, filters out the microplastics and the forever toxins, any waste it might have, and it puts the clean blood back in. And the clinic claims that the procedure can eliminate about 99% of specific toxins and chemicals in a single session. Is it proven? Not yet. But if you think about, the fact that, these chemicals and even toxins and they're pretty much everywhere, I hope he might be able to prove it because it might be something which many of us might want and need at some point.
Yeah. I've got the website here in the background. I hadn't heard of it before, and looking at it, because I was thinking this sounds like dialysis, and I don't know if I want dialysis, but then I suppose if they're taking it out, doing the filtering and then returning it, sort of step by step, it's, it sounds a little bit less risky and so on. But I suppose,
why not?
It's interesting. Who knows? It may take some time. If you're saying it reduces your risk of developing dementia, how are we going to be measuring this?
Yeah. Totally true, but I think it's because microplastic is something that we talk about a lot. And when I saw this, it was all over the social media feeds. But I was like, yeah, if he can manage that, he's something really, really nice.
I haven't heard of anyone else being able to remove microplastics. So whatever routines, we reduce the exposed to plastics to reduce the input, and then the question is, well, how on earth do you get them out? Because they're not coming out any other way, really, are they?
No, exactly. Okay. As per usual, I still have a couple of unusual ones to wrap this podcast with. I have 3. I'll let you choose the one that you prefer. So I have a new trend, a new well-being framework, and a new art installation. Aline, what do you want? A trend, well-being framework, trend? Okay.
Yep.
Have you heard of the cortisol craze? And what could it be?
Craze?
Craze. So it means like going crazy about cortisol.
Oh.
It's on TikTok.
I don't know. I've seen some ads on Instagram about cortisol, no, to adapt your diet to manage cortisol. Did this?
Yeah. Well, maybe Keith, you have an idea what it potentially could be?
So cortisol is one of the endogenous hormones that's associated with a number of different things, but most commonly stress, as in high levels of stress, high levels of cortisol. And so cortisol does good things as well, but, persistently high cortisol levels can have negative effects. So if there's a cortisol craze, it's going to be one of two things, I suppose, Christophe. It's either a craze in things that can reduce your cortisol, or a craze to try and increase your cortisol. Given that it's TikTok, possibly it's the increasing it, but I think it makes more sense to try and manage it. So maybe it's a craze for hacks to reduce your cortisol level.
Yeah, you're both kind of right, but the reason why they call it the cortisol craze is because more and more people go to the physician asking them to measure their cortisol. Because on TikTok, people talk a lot about you need to do some cortisol, detoxing. And we spend too much time on social media. It's the stress hormone. Indeed, people are promoting the diets and the supplements and making sure that the people have it a little bit under control or lower their cortisol. But for that, people just go to physicians to know how high their cortisol is, which of course is not really useful because cortisol peaks and goes down.
Yeah, it's very variable. Yeah.
It's very variable. So it's really like a typical kind of crazy thing that comes out of TikTok where physicians are like, what do you want? I mean, do you want me to measure your cortisol right now? What's the point?
Are they filming the clip? Are they going into the clinician saying, can I have my cortisol? And then the
No, it's a consequence. It's a consequence of all the cortisol discussions on social media where people actually go to physicians asking them to measure it, which kind of makes no sense. It only makes sense in some rare conditions. But I mean, it's completely unnecessary to do it one time. You should be able to do it like on a permanent basis to have an idea
there are
of
ways,
where your cortisol is.
There's direct to consumer offerings and there's different ways of measuring cortisol that don't require blood tests and so on. And I'm sure there are people trying to find a continuous monitor or a proxy measure out there. And, well, God bless them. But I mean, again, once you know what your cortisol is, so what?
Yeah, that's it.
What are you going to do with this? It always comes back to the same things. Try and chill out a bit.
Cool. New well-being framework or a new art installation?
I would like the art installation.
Art installation. It's the most difficult one, maybe.
I'm ready.
It's a new music art installation in Australia that is titled or called Revivification.
Ravification. R-A-V. Yeah, okay. So I'm
Revivification. Revivification. That's it.
Oh, R-E, not rave.
No. It's a so it's vivification, but revivification.
All right. Okay. So something music that in some way revitalizes or brings something back to life. And if it's anything related to wellness, I suppose it's about an installation where they'll play you lots of different, you'll hear different types of music that will in some way bring some dormant part of who you are back to life. And that might be measured by heart rate variability or something. I'll still keep it kind of medical, but maybe that's it.
Okay. Aline, you want to have a go at it?
I was thinking of like an interactive art piece.
It is sort of. So there's this musician, Alvin Lucier, I don't know how do you pronounce it. He was a composer. He died in 2021, but he prepared something before he died. And so a group of artists and scientists in Australia have created together with him an art installation that uses his cells. And these cells were used, his DNA was used to grow a certain tiny lab-made brain. You probably heard about the cerebral organoids. Mm-hmm. And now what they've done, so it's basically, it's a mini brain, tiny mini brain that you create in the lab based on DNA. And they connected it to, and it's alive, by the way. It lives on its own, and it's connected to a sound system. And so the mini brain fires electrical signals that hit metal plates in the room, making music, new music, in real time. So obviously the mini brain is not conscious, but it is alive.
We
And
don't
it is
know if
made
it's
from
conscious.
Say it again?
We don't
We
know
don't
if
know.
it's conscious.
Okay, let's just say it's not conscious, please. But it's alive anyway, right? Because it's made from the brain from the deceased artist. And he actually started this plan way before he died, because he was already an artist who was known to turn his own brain waves into music. So, and that is the real cool part about it, is that he actually does the same thing still after he has died.
Yeah, well, I mean, that's definitely different to what I was thinking, and it's very interesting. And if it's come from the artists themselves, then of course. But I've read too much sci-fi about what happens when people try and do this and what it means. So I'm a bit spooked by it all. I'd maybe not have a part of my own tissue kept alive.
Okay, let's not go there. So the final one, maybe for both of you, I think it's pretty easy. It's a new well-being framework. It's called JoySpan.
Okay. Aline, do you want to have a go first? Or shall I go?
Go. I'm still thinking.
Oh, I'll go. Okay, so I think, so we've had also like lifespan, then you've got health span and
Exactly.
And all these sort of things. So joy span is extending the period of time in your life when you are feeling joy.
Exactly. So lifespan is about living longer. Health span is about staying healthy longer. And so joy span is about living well and feeling good while you do it. Basically, it's having more joy over time. It's pretty interesting. I think in my last book, I always talk about these life aspirations. And to me, they are the making health and happiness, or the desire that people have to be healthy and happy, more tangible. It's the level just below. And one of these things is just simply joy. I mean, if you feel joy, you feel a little bit more healthier and happier, and vice versa. If you're healthier and happier, you can feel probably a lot more joy as well. And so this JoySpan idea is really something which is super interesting. And I wanted to bring it up because I think also in healthcare, we always talk about lifespan and health span more and more, certainly in the longevity area. But maybe we should more think about what JoySpan could mean, and how can we bring that into healthcare, whether it is, focus more on connection, because that might bring joy, design hospitals or environments differently so that maybe we can find more joy in the things around us. Like hospitals are very clinical, white, cold. Maybe we should bring that joy in there as well. Treating the whole person might bring more joy because you feel, personally approached. The whole environment of care, the way that, we talked about it earlier as well, the way that caregivers bring support, because somehow, joy has that impact on health and happiness. And I know it kind of made me think of quality of life, but I think joy span is not the same thing, right? It's really about having joy, and it's a part of the quality of life, but it's one of the things of quality of life, not quality of life in itself.
I think it's just, oh, go on. Sorry, Aline.
I'm saying joy can be little things as well, no? Eating something that you like, or doesn't have to be like a big thing.
No, exactly.
And the point that I was going to make is there's many philosophies which would say that the pursuit of joy is actually not a great idea in any case, as in, you should be aspiring to a sense of peace or calm or equilibrium, and, the pursuit of happiness, as in the sensation of being happy, actually, given part of balance, is actually possibly less quality in terms of life than pursuing a state of equilibrium and peace. I'm sort of thinking of Stoics and Buddhists and the like as well. So I don't think it would be universally accepted that you should be pursuing joy, although of course joy is a wonderful feeling to have. But I don't know. I'm with you maybe on this, Christophe, as it's, this is about non-negative emotions, or minimizing the time that you spend objectively suffering or subjectively suffering.
Yeah. Then again, I think I know where you're coming from with it might not be universally accepted. Then again, I think pursuing joy has always had this negative connotation because it's selfish. And
pleasure, yeah.
And it's too short-term focus. But I think the way that we might look at it is that it's okay to enjoy and to have joy. And I think that is, to me, always accepted. Whether it is, it's a different connotation than saying I'm pursuing joy and this is the most important thing in my life. No, just being able to enjoy, being able to have some joy. I think that is what it is about, I think.
Yeah. I suppose it's the same as accepting that it's okay to be sad or that, that it's okay not to be okay. It's okay to be super okay.
Exactly. Very well. Thank you all for your Healthusiasm this month. It is a Healthusiasm world indeed. We see so many positive changes that are making our world a little healthier and happier. Time to wrap up the Healthusiasm podcast for this week. Thank you for listening. If you like this show, hit the subscribe button on your favorite podcast platform. Go to healthusiasm.com to subscribe to the newsletter and learn about our panelists. For now, I'd like to thank our panelists for their Healthusiasm. Thank you, Aline Loiset and Dr. Keith Grimes. My name is Christophe Jauquet. We are the Healthusiasm panel, and we'd love to see you again next week for some more Healthusiasm. Ciao.